Hello, welcome to AUB. I'm Rami Khouri from the Media Studies program, and I am glad to be your host today and for the next 2 months as we do an event every week with one of the professors who are members of the special COVID-19 expert committee that was set up at AUB by President Fadlo Khouri about a month ago to bring together the expertise of our many different departments at AUB, and we will talk with one of the members of this committee every week to talk about issues about the pandemic, but also related issues, the economy, mental health issues, personnel issues, all kinds of related matters related to it, and AUB's role and what we're learning from this quite novel and important and very dynamic process. I'm happy to say that our first guest today is Dr. Carine Sakr. She's Assistant Professor of Medicine and Director of Employee Health at AUB. And she's the chair of the committee, so we will start with her, and then we'll have a different member every week. We're also going to go to New York, where we have Allison Freeland, who is the Director of Communications. Allison is with us in New York.
Hello, Rami. Hello, Dr. Sakr. Thanks so much for letting us join in. I work in the AUB New York City office, but as you can see, I'm at home today, as so many of us are. And online, we have with us AUB alumni and friends from North America and beyond. And I want to encourage all of us online to use the chat feature in Facebook Live to put in your comments and your questions. And I'll be relaying them to you in Beirut as I get them. And I won't take any more time because I understand that you in the studio are on a curfew tonight. So we want you to get home safely. But thank you again for letting us be part of this.
Thank you, Allison. So Dr. Sakr, welcome to the first program, and thank you for the amazing work you and your colleagues do on this committee. So let me start by asking you, tell us what is the committee, why was it set up, and essentially what are its aims?
Well, thank you, Rami. It's really a pleasure being here. So as you mentioned, towards the end of February, this is when President Khouri announced the formation, basically, of the COVID-19 expert committee. So the role of this committee is to enable us, the university, to adopt the necessary measures that are at the same time comprehensive but also evidence-based, so that we can adopt measures to mitigate the pandemic and its effect on AUB and the community at large. So it's a lot of expertise into one committee. So we have people from nursing, health sciences, medicine, and last but not least, communication, because a lot of what we do and communication is really key in this pandemic. So you have all these experts from different parts of the university working together. And it's really a very powerful tool. So you already sat at one of our meetings, so you know how it goes, basically.
Yes, I sat in on several of these meetings, and I was astounded by the incredible interdisciplinary interaction. It was like sitting in the headquarters of like a police station or a fire station when there was action going on, and there was constant information coming in, and all the information was coming from real serious research-based scholars at AUB. This was what amazed me. So tell us how you see the process as it has unfolded, and what do you see as the main impact so far? This has only been going on for what, a month and a half?
Yeah, pretty much. So as you said, you have all these different experts from AUB. Some bring their clinical expertise, some bring their public health expertise. Of course, we have our communication colleagues. But at the same time, we're not in a bubble because all of us have some sort of connection with other specialists, whether in the public sector or in the private sector. And things are moving very fast. So we would be, and we're in constant communication, all of us. I mean, we're on WhatsApp group, Saturday, Sunday, in the middle of the night. Every time there's something that's worth mentioning, we communicate with each other to make sure we are all on the same page. And something else that I wanted to tell you is that we also use all the expertise that is available within AUB. I mean, it's not only us,
Right.
but we know that unfortunately in Lebanon as well as worldwide, there's a shortage of personal protective equipment, PPE. So we contacted our colleagues at the Faculty of Engineering and we asked them, well, can you guys make some for us? And now they're in the midst of doing that. They are trying to create some respirators, some masks. They will test us before, they will test them, sorry, and we will test them as well before we start using them. But this is really interprofessional collaboration at its best.
Yes, and when I attended, I noticed the nutrition people would come and say something, and then the health education people, and the communication people, and the research to policy center, and each person would chip in and say, I spoke this morning to the minister, I was with the WHO. This incredible interaction. What does this committee, and by extension, what does AUB contribute to Lebanon and maybe the region more than each of you individually contribute?
So at the end, the final product would be a message that is scientifically sound and that is relayed in a format that people understand very well. So we have been producing a lot of material, and whether it's posted on our website, whether it goes on our different social media platforms, there are a lot of videos, vignettes, posters. The goal here is really to arm people with knowledge and science so that really learn what they need to so that they can continue with their lives. I mean, some people still have to go to work. People have to do their grocery shopping. People have to interact with others, although much less now than before. But still, we are trying to provide here really the science, the knowledge, so that people have it and then they can use it in their day-to-day life.
And your main target audience, is it AUB administration, AUB staff, students, the community in Lebanon, people around the world? Who do you see as your main audiences?
I mean, we start with home, which is the AUB community, our workers, our employees, staff, etc. But then it gets bigger, and whatever is applicable for our healthcare worker at AUB MC can be used by anybody. So our video about how to appropriately put on donning and doffing of PPE is available for everybody to use.
Right.
It's here, it's produced at AUB, but everybody can use it, so it's out there basically.
And you produce your outreach materials in English and in Arabic both?
That is correct, yeah.
And you share these with the government, other hospitals, the Ministry of Health,
Absolutely.
WHO, anybody who's interested?
Absolutely, yeah. I mean, we're working on many initiatives with the European Union. As a matter of fact, this afternoon we just came back, my colleague Dr. Nada Milham and I had a meeting at the Grand Serai, which is the
Prime Ministry.
The Prime Ministry. We are part of a committee, among others, from the public sector and the private sector, creating some sort of tool so that we can audit hospitals and assess their readiness to care and be able to admit basically COVID-19 patients.
Oh. So as this process proceeds, and it keeps evolving literally every day.
Absolutely.
It keeps changing. You keep learning things. You keep providing new services to different audiences, different sectors. Does this possibly suggest an evolving role for the university in society, looking forward?
I mean, I think so. You said it best. Yeah, I think so. I mean, a pandemic is something that we are facing now, and all of everybody's problem, and everybody's talking about it. But this could be applied in other areas as well. I mean, you know very well. I mean,
Well, we'll be talking to other professors in other sectors, but when you look at things like water, climate change, environment, pollution, youth, gender issues, these are multi-dimensional, and this is probably the first major fixed committee, standing committee, to do multisectoral work among AUB professors, as far as I know. So it's a kind of a pioneering effort.
It's novel, like the virus.
Novel, yes, yeah, exactly. And what about, when you look at the alumni are listening in, and there's other groups of people around the world who are linked in with AUB, like colleagues at other universities. Do you see a possible expansion of how all the different elements in AUB, professors, students, alumni, staff, can somehow play a role as this process moves ahead?
I mean, I think so, definitely. You have AUB alumni all over the world, and a lot of them are extremely successful, and so yeah, for sure.
Okay. You are also...
Excuse me, Rami.
Yes.
I just wanted to say we have people who are logged in from Houston and Montreal, and from Maryland and from Atlanta, and one person has made the comment that it's ironic that she feels she might get better care and information from AUB in Lebanon than where she's living.
Wow.
And we do have one question that perhaps you can put on the docket today, and that is lessons, Dr. Sakr, that you have learned about working in a committee of experts, as so many people, at least in North America, in government, are trying to form committees. I wonder if you have lessons learned that you could give them.
Well, first of all, I wanted to mention this in the beginning. It's really a privilege to be part of that committee, that AUB Expert Committee on COVID-19. I mean, you have so much knowledge into one room. I mean, each one of us studies one section and is really good at it. But instead of working in silos where nobody's talking to anybody else, here all of a sudden we're all sharing our information, and this is really what makes it powerful. Like I would need some ideas regarding how can I better train my healthcare workers. I have so many of them. And then you have somebody from the School of Nursing tell you, well, let's use our nurses, we can use our nursing student, we can use a train-the-trainer model. So I mean, and there's a lot of tendency in healthcare now to go towards interprofessional collaboration. There are courses in interprofessional education even here at AUB. So I think that's the way to go. It's too complex to be done just by one group of individuals.
Of course, and I imagine one of the challenges is, you know, I'm a layperson, I follow it on TV, and every day there seems to be a new discovery. For instance, joggers now have to stay further apart because when you're jogging, the particles go further, and so there's constant change, and you've got to react to that and look at research.
Look at research, look at the science. And unfortunately in this pandemic, and very often we see a lot of fake news, fake information, and it scares the public. So we really have to sit down, think, put the science, and then put it out there and educate people.
So you came to AUB from Yale University, where you worked?
I was at Yale, yes.
Yeah,
I stopped by the United Arab Emirates for 2 years, and then I came back home.
And there's all of your colleagues have worked at fine universities or studied all over the world. So all of you have links with colleagues all over the world. Is this a dimension of this committee that is possibly activating?
Yes, absolutely, and it helps a lot. Like I was listening to a webinar last night, 7 p.m. here, so it was 12 p.m. at Yale in Connecticut, and we were talking about modeling, curves. So we're all trying to get all our resources from our colleagues, friends abroad, and try to bring everything here, basically.
Okay.
Yeah.
Your expertise, along with internal medicine, is occupational health. And you are, one of the positions you have is Director of Employee Health at AUB. and this is obviously a huge issue all over the world. The people in, the nurses, the doctors, the staff who work in hospitals, they're in danger, some of them, and some have died. So what have you learned about this particular issue here in Lebanon, even at AUB Hospital and others, and how has the committee responded to this?
So as you mentioned, Rami, this has been a huge issue for healthcare workers all over the world, whether it's Italy, China, everywhere. There was a report last week from the CDC regarding healthcare workers that got infected with COVID-19 in the US, and we're talking about close to 9,000 people, and unfortunately many deaths as well. So it is a huge issue, and this is a virus for which we don't have a vaccine, at least not yet. We don't have a well-defined treatment, also not yet. But all what we have is prevention and preparedness. So we made sure that all our healthcare workers, and this includes doctors, nurses, anybody who's going to be in contact with patients, housekeepers, cashiers, we made sure that we trained them appropriately to be using what is needed for each encounter in terms of personal protective equipment. And so we did trainings, we did follow-ups, we are going to be doing refreshers constantly. And whenever there's, for one reason or another, there's an exposure, then we follow our exposed employees. We make sure we monitor their symptoms. And if somebody needs to be pulled out of the workplace, we will do so, just to make sure that our employees are healthy, but we don't want them to be vectors of infection for other patients or for other employees as well.
And one of the things that AUB did also very quickly, in a record time, I think, is set up a clinic for the COVID patients, or testing people and taking in patients. What have you learned from that process, and does it generate new research and learning opportunities for the faculty?
Definitely new research and learning opportunities, and I mean, it was the right thing to do, and this is a recommendation that we've seen from many authorities, be it WHO or the CDC, which is try to separate your COVID patients from your non-COVID patients. Mm-hmm. So we did that in a record time. Really, a lot of people put a lot of effort, and the clinic was created, and we have a testing area, and then we have also an area to admit patients, and we have an intensive care unit there as well.
So are there situations from the experience you've had in the expert committee at AUB, from when you started until today, that you are now doing some things differently than you did a month ago? Because as things progress, you've learned new things, whether it's treatments or testing or public outreach or whatever it may be.
So the algorithm are being updated as we go. So this is why on the committee we have an infectious disease specialist, an emergency doctor as well. So these are being updated as we go, and we're kind of responding also to the public's comments. So whenever people reach out to us and tell us, well, we need some information about so and so, we kind of respond accordingly.
Mm-hmm. And at AUB itself, faculty, students, staff, and others, we've done pretty well in terms of protecting the community at AUB?
So far, so good. I don't want to jinx anybody, but so far, so good. So far, we didn't have any. It might change. I hope not. Mm-hmm. But we are really working hard to keep our healthcare workers as protected. We do have a question.
Allison, to New York.
Yes. Actually, we have a couple questions that tie together, and they're about underlying conditions. And one is, of course, a very personal question to you, Dr. Sakr, and that is for someone who is on blood pressure medication and that keeps his or her blood pressure monitored, would that still be considered an underlying condition? But then the greater question is, how are you dealing with employees and patients and the issue of underlying conditions?
So blood pressure has been listed as one of the risk factors. That is correct. The controlled blood pressure is definitely better than an uncontrolled one. Now, in terms of how we did for our workforce, we took a rather conservative approach whereby people with high-risk conditions would not be working in that unit. So people with known underlying heart disease, lung disease, immunosuppression for one reason or another, we just decided in the hospital not to have them care of COVID patients as an extra precaution. At this point, we can still accommodate that. So.
Okay. And do you have another question, Allison?
I do. Someone is asking, this is from Houston, if patients are separated depending on the different strains of the virus.
Not yet.
Okay.
Not yet.
And someone is making the comment that machine learning can help us a lot in these situations. You're obviously stirring up a lot of thought over here.
Let me ask you about the linkages between what you're doing in the committee, the public outreach, you're advising the AUB administration, and other efforts that are going on. AUB also has, from this same AUB COVID-19 studio, there's a program twice a week in Arabic with a Nahar, which goes out to the Arabic-speaking community, talking a lot about local technical details, while we're looking more at a global community in English. But there's a lot of people doing a lot of things. If you were to pick one priority that you understand to be the most, not everything you do is important, but the most impactful thing that your committee does, what would you say? Is it reporting to the AUB administration about how to care for the community, or is it linking with other people throughout the government or other hospitals? How would you prioritize?
I mean, they're all important, because what we are doing here, and when we report back to the administration, giving them input on things that are as detailed as visitors policy.
Okay.
Because visitors can be asymptomatic carriers and can therefore transmit the disease without them knowing. So whether it's that part or everything that we are doing with the government, because again, as I told you, Rami, we are using all our knowledge, or whatever for the last 2 months, probably 80 to 90% of my work has been this. So all of that product, we're basically giving it to the government when they're asking us. So they're kind of linked, they're intertwined.
Of course. The issue of testing is very much in the news all over the world. And apparently we've got to test before we can relax the quarantines. What's your experience with that, and how is the committee dealing with that?
So you need enough tests to be able to test.
Yes.
Yes, definitely. We need to test for 2 reasons. First of all, as I mentioned, you have your asymptomatic COVID positive people. Once you test them and identify them, you take them out of circulation.
Okay.
You isolate them, and then you prevent further spreading. So that's one reason for testing, aggressive testing. The other reason is to be able to have an accurate representation of the prevalence of this disease in the community. Unless you're testing, you don't know what's going on out there. So before we start relaxing, as you were just saying, we need to understand what the picture looks exactly like, so that we can keep monitoring it and see the impact of those measures that we're about to take, if we're going to do any relaxing measures.
And if we look at Lebanon as a whole, what's your impression of what the country has done best and what the country where it's weakest in its response to the virus?
I think the response was very good in terms of the government response, how people, obviously it wasn't 100% lockdown, but in a way people were compliant with what we've asked them to do, like stay at home, work from home, etc. I think we can praise them for that. Where we have some way to go is our testing capacity, but that's not only us, and our PPE readiness as well. Unfortunately, we have some shortages.
Excuse me, Dr. Sakr, we have a question about testing, and I know there's only a few minutes left here, but this is the question. Do you have a good idea about the PCR test sensitivity in Lebanon. In the USA, the first generation of tests may be 70 to 80% sensitive only.
Yeah.
That's from Houston.
Yeah, we're above 80%.
And while I have you, we have another question about the difference. Is there a difference between the concern in Lebanon about the capacity of hospitals to handle patients and the concern in North America where it has become such a problem?
I mean, we will have issues if our curve goes steep all of a sudden. So this is why, this is basically what we tried to do by keeping people at home, just to try to flatten it as much as possible. If we keep the curve the way it is, we should be fine.
Okay. One of the things also that must be on your mind in the committee now are the mental health implications for the stress. I mean, everybody is having to adapt to this new situation, and it's stressful, and stress can lead to other issues. Are you addressing that? Do you have a mental health person on the committee, or do you consult them?
So we don't have a mental health person on the committee, but we work with them very closely. And at AUB, we have multiple initiatives, whether it's for students, staff, our patient community, and a lot of messages are going out actually on our social media platforms to educate people about how to deal with this. It's a very stressful situation, absolutely.
Yeah, it is.
Yeah, so we are working really and strongly collaborating with our psychiatry colleague at AUB.
Wow. Well, I relieve the stress by walking out and feeding the cats at AUB, and that's a big stress reliever, but not everybody is able to do that, unfortunately.
You have a big campus, yeah.
The information that you generate from your interaction, there must be masses of important information that's not always new necessarily, but the interaction between different disciplines is something unusual and useful. Are you documenting this? Is there a mechanism to archive this knowledge so that people can have access to it and sharing it with other people, either online or in other ways?
So we're trying to keep our website as updated as possible, so all the communication stays there. You will have access to previous communication, and from the website it also links you to the COVID repository at AUB MC for clinical information, and you also have links to the COVID studio, so everything is there pretty much.
And so people can go to the AUB main website, and there's a big thing in the corner about COVID expert committee or the COVID issue.
COVID expert committee, and then you have links to other resources as well.
Okay.
Rami, we have two more questions, and this will probably be the last from North America, but one about Dr. Sakr, if you have recommendations on masking for all of AUB, and then a completely different question, which is about any information on the presence of the virus in the Syrian camps and what safety information might be being conveyed to them. And then I'll call it quits for questions from here, as I know we're running out of time, but we will make note of all the questions and bring them up again when we do this next week.
So masking, first of all, so whenever social distancing, like there's like 6 feet between Rami and myself now, whenever social distancing cannot be assured, then we're asking people to wear masks. For healthcare providers now, we are at the point where we are asking all of our healthcare providers to be wearing masks at all times when they are doing patient care. Patients coming in the hospital, a lot of them are also wearing masks, visitors as well. Whenever there's close proximity between people, I mean, and this is a recommendation that has been circulating recently, and this is what the CDC has been saying as well in the United States. So we're going to be wearing masks for a while, I think.
And the camps, you asked about the camps?
So camps, I do not have a lot of information. Unfortunately, as a committee, we did not do any specific work with the refugee camps.
Okay. Anything else from New York, Allison? That's it?
I think we'll leave it there. I know we're running towards the end of our time here.
Okay, so I will close up by asking one last question. What's the single most important thing that you personally have learned from this experience as chair of this extraordinary group of experts and professors who are interacting every day at 1 p.m. every day? They meet online now. They used to meet in person. At your personal level, what have you gotten from this?
I learned a lot. So I learned a lot, and I think I understand better now the power of the team and the power of the group. I mean, the final product is much more potent than, I would say, the sum of the individual components.
Right, and this raises big issues about the opportunities for not just AUB, but any good university in terms of how it can harness its knowledge to make life better for everybody.
Couldn't agree with you more.
Well, that lets me mention that next week we're going to have as our guest Dr. Fadi Jaddali. Fadi Jaddali is one of the extraordinary members of this terrific committee, and he heads the Health Management and Policy Unit department at the Faculty of Health Science, and he also is director and founder of a center called Knowledge to Policy, K2P, which takes knowledge that researchers and professors and others develop and translates it and transmits it to public policy and media. And we'll talk a lot with him next week about this. So thank you, Dr. Carine Sakr, for being our inaugural guest on this
Thank you so much.
weekly episode. Thanks for the extraordinary work you do. We all benefit, and ultimately all humankind benefits. So thank you to all of the people who've been involved in getting this initiative launched. Martin Asser, head of communications, Joseph Azer and his crew who do the technical work, Alison Freeland and her colleagues in New York, and Dr. Fadla Khour, whole process of the committee, and that we're happy to be part of in terms of sharing the knowledge with the world. So thank you all, and join us again next week, Wednesday, 6 p.m. in Beirut, 11 a.m. Eastern Time in the United States.